Now we can talk about some common dressing types. Now, there's a lot of different brand names out in the market, but they all try to serve a different purpose. And it's useful to classify them based on their indication. So, there's a couple of different types. For this discussion, let's talk about four main types of dressings. So, there's moisturizing. There are dressings which are absorbent. There are also protective. And special. So the moisturizing dressings, let's start with this category. And the main one here that I want to talk about is hydrogel. So what a hydrogel is really, you can tell from the word, it's a gel-like material which is made of usually glycerin, which has the very important property that it retains water. It's a polymer matrix which contains a lot of water molecules. So this type of gel, when it's put over a wound, it moisturizes the wound by diffusing out water. What this does is it both creates a moist environment for the wound, if that's needed, if a wound is dry, and it also provides some cooling, pain relief, and symptomatic relief to the patient. There are a few different types of absorbent dressings. So these will serve the purpose of drawing moisture out rather than putting moisture in. So first is alginate dressings. So what a alginate dressing looks like is looks kind of like a sheet of almost like a felt-like material, and it's made of a lot of polymers of alginate, which is a naturally occurring polysaccharide. So it's derived from plant-based material. I think a lot of it is contained in some types of seaweed. So sometimes it's mixed with CMC, which is carboxymethylcellulose. So that's a cellulose-based material, which is also a polysaccharide. So what these do is, when there's any kind of moisture, they absorb it. The water molecules get attached to the polysaccharide molecules. So this is one type. There's also foam. And foam, it's easy to think about. It's very porous. It's a very porous material, and that also will draw up water into it. So that's a very useful type of dressing to use when you want to soak up extra moisture. There's a type of dressing that kind of combines both of these. Could be in a special category, but I kind of want to put it into kind of a mix of these. It's called a hydrocolloid dressing. And what this dressing is it's really a thin sheet of the hydrocolloid, which is attached to a film, such as a polyurethane film. And what this material does is, it both it sits on top of the skin. It absorbs moisture into itself, but since it's so thin, it keeps moisture around, so it still maintains a moist environment. And what it does is it also takes bacteria from the surface and absorbs some of it into itself. So when these are pulled off, these kind of create a kind of mechanical debridement of wounds. So it's an interesting type of dressing. Protective dressings, these are going to be the low adhesive dressings. And what these are made of is, you can kind of think of these as a thin mesh. So usually these are made out of silicone, and these are like cross-linking. Well, not cross-linked because it's not chemically based. It's on a physical scale. So it looks like a gauze piece of dressing, and what this does is, because it's not, these strands are very big, it doesn't really allow for any considerable drying up of moisture. What this does is, really, it's a thin dressing which lays over the wound and it protects it from abrasive forces. You know, if the patient's laying in the bed and moving around, and there's, you know, the bed sheets are moving around, and you just don't want the wound to be in contact with all of that, you can use a low adhesive dressing. Now the special dressings, really there's two important types. So there's dressings that are used for odor control. So what's important about these is it's a pad, which I'll color it in black, because what these contain is activated charcoal. And what this does is, it, just judging from the name, it makes sure that the wound doesn't smell too bad. And there's also antimicrobial dressings. And what these are different types of dressings that are impregnated with certain types of materials, or certain types of compounds. The two main ones that are used are iodine. So the brand name, and this is commonly used on the words, is iodoform. The iodoform dressing is an antimicrobial dressing. And also silver. So, and you know, as research goes, essentially these are pretty controversial of whether they help or not. But these are dressings that are available for, you know, if you have an infected wound. And we'll get onto specific indications and how to think of these systematically in the next video. So click on the link and keep watching.